My name is Kara. I am a physician assistant and health coach, and I focus on functional medicine and fitness to get you to your healthiest and happiest self. Today, I'm going to talk to you about what the heck is wrong with your gut. What symptoms might you have if you have ongoing gut issues? This is obviously going to vary person to person. The most common ones obviously being issues with your digestion. So that may look like bloating, abdominal pain, cramping, nausea, vomiting, diarrhea, constipation. But you may also notice other symptoms that could very well be related to your gut that are not necessarily digestive symptoms. So that could be like skin issues, eczema, rashes, hives, especially after eating certain foods, or even more extreme skin conditions like psoriasis. You could also notice things like brain fog or changes with your moods, so anxiety, depression, and why this occurs is because so many of the neurotransmitters that are in your brain are very much affected and produced in the gut. So if your gut health is off, you could have a lot of issues with mood changes or anxiety or depression. So what are some common gut issues that I see with both my patients and my clients? Obviously, there's a wide range of different issues. I think there's even memes going around that all hot girls have gut issues, and I half the time feel like that's true because I feel like so many women especially deal with this, which is chronic constipation. A lot of times these issues can be resolved by fixing some lifestyle factors. So a lot of women honestly just do not drink enough water, they don't eat enough fiber, and they may not eat enough across the day regardless. So a lot of people, whether it's stress related, lack of water, lack of fiber, sort of induce constipation just because of lifestyle. But for many people, there is an underlying reason as to why they have these issues. Some of the symptoms I mentioned initially, or constipation. So 3 big ones I'm going to talk about a little bit more in detail is H. pylori, SIBO, and leaky gut. You may have heard of these before, but what would each of these actually look like in an individual, and what would you do to treat it? So there is a lot of different testing that you can do in order to evaluate for these gut issues. My favorite form of testing is GI map because you can see everything with one panel. This is a little bit more of an expensive test. This is going to look like usually upwards of $300 to $400 for one GI map test. This is going to be a stool study, so you can collect it at home. You send the sample back in to the lab, and then your provider will get a very comprehensive breakdown of a lot of issues that could be going on with your gut. So what are some things that a GI map is going to show? It's going to show the bacterial pathogens that are in your gut, whether that is good bacteria, bad bacteria, and the levels of each of those. It is going to tell you if you have any pathogens in your gut. So that may look like H. pylori, that could look like viruses, that could look like fungi or other bacteria that could be causing abdominal issues. The GI map is also going to give us information about what your level of inflammation looks like in the gut, which is very, very important, especially if you have ongoing pathogens. We want to know if those pathogens are affecting the inflammation levels in your gut. You will also be able to see if you have sensitivities to gluten, which can be very helpful for people. Sometimes people cannot determine if they have sensitivities to gluten just based off of trying to cut gluten out of the diet. There are obvious foods that have gluten in it, but then there are also foods that are cross-reactive with gluten, so you may be consuming gluten and not even realize it, thinking you're gluten-free and still having symptoms. So first I'm going to talk a little bit more about H. pylori. H. pylori is a bacteria that is in the upper part of the GI tract, so that is going to be your actual stomach. H. pylori is very, very common. It's estimated that about 50% of people in America have H. pylori. H. pylori is highly transmissible, so there's a good chance that if your partner has H. pylori, you do too, and vice versa. Treating H. pylori can be difficult. Typically, it's going to take 3 different medications or 3 different supplements to get rid of H. pylori. And then the problem with it too is that if your partner is not treated, or if someone you're exposed to is not treated, you could just get H. pylori right back. So because H. pylori is in the upper stomach area, symptoms that you're going to have with that usually are upper GI symptoms. So that's going to look more like bloating, nausea, reflux, indigestion, very common symptoms with H. pylori. But you could also have downstream effects of that, so diarrhea or constipation. I worked in conventional medicine for years before I moved into functional medicine. So if you are in conventional medicine, typically you would treat H. pylori with a combination of 3 drugs. It's typically looking like 2 antibiotics and 1 PPI, something like omeprazole or pantoprazole. Why I don't prefer that method anymore is because there is such a high resistance to antibiotics, especially in America. Not only that, when you have H. pylori, it makes you a lot more prone to low stomach acid or decreased stomach acid. That is terrible for digestion and can lead to a lot more issues, which we'll discuss a little bit later in the video. But as you may know, treating H. pylori with something like a PPI, which is pantoprazole or omeprazole, that medication's job is to decrease your stomach acid. So while it may temporarily help your symptoms, overall, it's just kind of decreasing your stomach acid when the pathogen itself is already decreasing your stomach acid, which again is terrible for digestion. So now that I have moved into functional medicine, I opt for more natural treatments, botanicals, and antimicrobials that are not necessarily antibiotics. As far as treating H. pylori, things I love to use for that are supplements like berberine, mastica or mastic gum, and oil of oregano, thyme. There's also plenty of other supplements and botanicals that can be used to treat H. pylori. Those are just the ones I tend to gravitate towards. Now, when you are treating H. pylori, because this is a pathogen that really likes to stick around, it's very hard to get rid of. You're going to likely have to treat this or take the supplements if you're the patient for 60 days. Now, whether this is you're getting treatment through antibiotics or if you're getting treatment through natural supplements, it is going to be a longer treatment. It is definitely going to be a longer treatment. I tend to opt for about 60 days treatment. And again, if you are being treated, it's very important that your partner also get treated, especially if they have any symptoms, or they should at least get tested to see if they are also positive for H. pylori. You would hate to go through an entire treatment of 60 days and then just get the pathogen right back because your partner gave it back to you. All right, number 2, next issue that I see with the gut very commonly is SIBO. So what is SIBO? SIBO is small intestinal bacterial overgrowth. What does this mean? When you are not properly digesting your foods, when you are not getting rid of your foods, when you have chronic constipation, or when you have something like H. pylori and you have low stomach acid and it is not breaking down the foods, you can have an overgrowth of intestinal bacteria. So this is what SIBO is, small intestinal bacteria overgrowth. We want a certain level of bacteria in the gut, but once it starts to overgrow, we can have symptoms with this. SIBO symptoms, again, sort of similar to H. pylori, but you're going to have a lot of issues with bloating, distension, abdominal pain, diarrhea, constipation, depending on the type of SIBO, depending on the person. How do you fix SIBO? Well, you kind of figure out what's causing it. So if it's H. pylori, you want to treat the H. pylori. Digestive enzymes with every meal can be really great for SIBO because it will help provide the enzymes that you need to break down the food and break down the nutrients. When you have food sitting in your stomach and it's not being broken down properly, that is how bacteria overgrows. So if you can take a supplement like a digestive enzyme that will help your body break some of these foods down and these nutrients down, you will not have as much overgrowth of the bacteria. Certain pathogens, certain bacteria that overgrows to a large degree may need to be treated in itself. And again, you should be going through a provider for this, or you should at least be having a GI map so you know which bacteria are overgrown. I would not recommend just throwing antibiotics or throwing certain supplements at people without testing because you don't really know what you're treating. I've had plenty of people where we think they might have symptoms of SIBO or something along the lines of that, and then we test them and they actually have low amounts of bacteria. So that type of treatment is completely different than someone that has an overgrowth of bacteria. Third issue that is very common is leaky gut. You may have heard of this before, but maybe not sure what exactly that means. Everyone's gut is leaky to some degree. The gut is a permeable membrane, so that means certain things can go in and out of the gut lining, and that is okay. But when you have leaky gut, that means more things are leaking through the gut than they should be. So that could be toxins, that could be bacteria. Again, everyone to some degree has some bit of leaky gut. It's just how severe it is and how much symptoms are you having because of the leaky gut. One really important thing you want to do with leaky gut is to restore the gut lining. Supplements that can be very helpful for this are things that contain L-glutamine. Again, this is going to help restore the gut lining and help with leaky gut. It's important to note that leaky gut takes a very, very long time to heal, 6 to 18 months sometimes. So this isn't something where you can just take a supplement for 2 weeks and expect that it's going to resolve. You likely will need to be on these supplements for extended periods of time and doing certain lifestyle modifications for extended periods of time. So overall, how can you fix your gut? How can you improve your digestion? One, I'm always going to recommend that you get stool testing so we actually know what's going on with your gut. You can take a whole bunch of supplements, but you could be throwing your money away if you are not treating the correct things. So get a test, get a GI map, work with a provider that can actually evaluate the test and get you set up for a protocol to help you work through some of these issues. Restoring digestion regardless of the issue that's going on is going to be huge. So if you struggle with chronic constipation, fixing that as you're going through this protocol is huge. If you are not fixing your constipation, when you are trying to rid these toxins, when you are trying to get rid of pathogens, or you're taking supplements to get rid of H. pylori, for example, if you are not regularly going to the bathroom, you will not be able to rid of these things. So you need to make sure you're regularly going to the bathroom, improving digestion, improving your constipation. You want to have a good balance of good bacteria to bad bacteria. So how do you do this? You reduce the bad bacteria if they are overgrown. You increase the good bacteria if they are low. So good bacteria can come in the forms of probiotics. You can also get this with certain foods like prebiotics and probiotics. Again, you can get pre and probiotics with supplements, but very, very important and very healthy to include them in your foods as well. Prebiotic foods are going to look like tomatoes, garlic, onion. Probiotic foods are going to look more like fermented foods, so kimchi, yogurts, pickles. Next way to improve your gut, like I already mentioned, is fixing the gut lining. Everybody to some degree has somewhat of leaky gut, and most people could benefit from improving the gut lining. So supplements like L-glutamine can really help here, and especially avoiding triggers that will worsen your leaky gut. Next thing I'm going to recommend, like stated before, you are going to want to get rid of the pathogens that are present. So whether that's H. pylori or certain bacterial overgrowth, you are going to want to get rid of these pathogens if they're causing symptoms. A lot of times this can be done with natural supplements, and in fact a lot of studies have shown that natural supplements work just as well, if not better, than antibiotics. And you also don't have the issue with antibiotic resistance. You don't have as many of the side effects with it. And when you take antibiotics, you run the risk of decreasing your good bacteria. That won't happen with natural supplements. Lastly, and most importantly, you obviously are going to want to improve your lifestyle. There's not really much of a point if you're going through this whole process just to be eating terribly, not exercising, not sleeping, because for one, you're probably not going to fix a lot of these issues if your lifestyle is crap, and for two, a lot of these issues, if you do fix them, are just going to come back. So going back to the basics, making sure you're sleeping, quality sleep, 8 hours a night. You are eating a healthy diet full of diverse foods. Now, while you're going through these protocols, you may have a more specific diet and you may need to follow something a bit more specific, like a low FODMAP diet. But once you are out of your protocol, you want to be consuming foods, you want to be eating a diet that is very diverse, lots of different micronutrients, lots of different pre and probiotics, and obviously making sure you're consuming enough fiber in your diet. That is also going to be huge for digestion, fiber and water. Any questions, please feel free to reach out to me. I do GI map testing and review, as well as setting up your GI protocol. Send me a message if this is something that you would like to look into for yourself, and I'll see you in the next video.